Apheresis procedures like therapeutic plasma exchange are often an important part of a patient's therapy, specifically in some kidney-related conditions. These conditions are often treated with immunosuppression, which will further prevent production of autoantibodies, but plasma exchange can be the fastest way to get rid of a pathogenic autoimmune antibody. A condition in nephrology that is treated with apheresis includes antiglomerular basement membrane disease, but it can also be used in other rapidly progressive kidney diseases. So there are many different apheresis procedures available in the US and worldwide. Plasma exchange, or also known as plasmapheresis, is the most commonly used procedure. And this is where you remove someone's plasma and take away whatever the pathogenic substance is that you want to. But there are other procedures that are available, and many times it is the nephrologist who's the skilled physician in extracorporeal blood purification procedures who is supervising these apheresis procedures. So some other procedures that are available and have applications in nephrology include lipoprotein apheresis. So this is a selective apheresis procedure that was initially designed for the removal of high cholesterol and genetic hyperlipidemia conditions, but it was found to have benefit in some nephrotic syndromes, specifically in focal segmental glomerular sclerosis, and it now has an FDA indication for treatment of that. There are other apheresis procedures available in the US, including red cell exchange, which is often helpful in conditions like sickle cell disease. There's a procedure called photopheresis, which is used in some types of cellular chronic rejection in transplant patients, as well as in a cutaneous T-cell lymphoma. And then there are other procedures where you can use apheresis to reduce white cells rapidly or platelets rapidly, or even collect white cells and stem cells for therapeutics in cancer therapies. Trials in apheresis have been challenging. Part of the reason they're challenging is we're often treating rare diseases. And so recruiting the number of patients can be difficult. For decades, we've been using plasma exchange for the management of various rapidly progressive glomerular nephritises like anti-GBM and ANCA-associated vasculitis. The use was always for ANCA-associated vasculitis to add plasma exchange as part of the initial therapies in someone with advanced kidney disease that was rapidly heading towards dialysis. Recently, there was the largest randomized controlled trial done with plasma exchange in ANCA vasculitis called the PEXAVAS trial. And unfortunately, it did not show that plasma exchange showed a benefit, but there was much critique after the trial about the design and the endpoints that were looked at. For instance, patients did not require a kidney biopsy, and this is a relapsing disease where fibrosis may be a significant part of their kidney biopsy findings if it has relapsed. Also, they treated patients with much lesser degrees of kidney involvement than was the standard practice in the past. And this wasn't really what plasma exchange was used for in this particular disease indication in the past. And so while there was a large randomized controlled trial, it actually created much controversy around the world, where some practitioners said, I'm not going to change the way I practice, and I'm still going to offer plasma exchange. And others completely stopped offering plasma exchange. However, now that we're a few years out post-PEXAVAS trial, meta-analysis have emerged, and it's shown that there can be an early benefit of adding plasma exchange in a certain patient population. And so the pendulum, I think, is starting to swing back again. And this is where it's really important for the scientific community to come together and make sure study designs are appropriate, but also critically appraise the literature and decide what's right for the patient that's sitting in front of them. I think one of the challenges of apheresis research is not just that we're often treating rare diseases, but it's also a specialty that is owned by different medical specialties. So sometimes it's a nephrologist performing apheresis, sometimes it's a hematologist, sometimes it's transfusion medicine. It just depends on the center. And so even at large national meetings like the American Society for Nephrology's meeting, there's very little attention given to apheresis. And I think the same is at the large hematology meetings as well. And so, I think when you have a procedure that's done by multiple specialties, this sometimes can be a positive in that you're bringing together a multidisciplinary approach, but it can also be a negative because it can be harder to do these large trials in patients and to move the field forward through one discipline. I think something to look forward to in apheresis is that around the world, there are some selective columns being used. In the US, when we do plasma exchange, we're removing both the good and the bad. And there are columns out there that can be designed just to remove one specific factor from the plasma, the desired substance that you want to remove. For instance, if it's just an IgG antibody you want to remove, it will remove the IgG, but it returns the albumin, it returns the other plasma proteins to the patients, and eliminates the need for replacement solutions. And so currently in the US, we only have one selective column, and that's the lipoprotein apheresis procedure. But around the world, there are many different columns in use, and that would be something that I think would be of interest to apheresis practitioners in the US, trying to get some of these more selective procedures available. Often nephrologists are the ones supervising apheresis, particularly in private practice. And there's very little attention to apheresis education programs at the national level. And even in training, when nephrologists are going through their nephrology fellowship, it depends on what center they're trained at, how much exposure they get to apheresis. So in the US, there is a need for more dedicated apheresis educational programs. And your only opportunities to get this education are at the American Society for Apheresis annual meeting, as well as the University of California, San Diego apheresis meeting that I host, which is called Essentials and Advances in Apheresis Therapies. This month, at the end of the month, we'll be hosting our 12th annual event. It's a 2.5-day conference, and it's designed for both physicians and nurses who practice apheresis or are looking to embark on an apheresis practice. So during our conference, we make time to cover all the basics for new users, but we also go in depth on disease-specific indications, best practices, emerging indications for apheresis, current controversies in apheresis, and any new innovations, so that even a returning participant or an advanced practitioner in apheresis would be able to walk away with enhanced knowledge of apheresis at the end of the course. We do this both through formal lectures as well as hands-on workshops, and we invite faculty, both nationally recognized and internationally recognized experts in apheresis. And we try to change the course year after year so that there's always something new for our participants.